Good morning, everyone. This is Nicole, and I am very interested in CRISPR, as you can tell if you've been on my channel. I use CRISPR every day with a lot of the cells that I'm working with. But there was another article published a couple of days ago about how CRISPR is being used to treat patients with a dangerous blood disease. So, this picture is a picture of red blood cells, as you can see here. Um, so, a Swiss biotechnology company says that it has used CRISPR to treat patients with beta thalassemia, marking the gene editing technology's inaugural trial run by the Western drug industry. The treatment they're using is from CRISPR Therapeutics of Zug, Switzerland, says it used CRISPR to try to cure a single patient of beta thalassemia, and that's a dangerous blood disease that leaves people dependent on transfusions. So they have to get constant transfusions to combat this blood disease. The other blood disease that comes to mind, which is genetic, is sickle cell anemia. I'll get to that in a minute. Vertex Pharmaceuticals of Boston is sponsoring the effort to use CRISPR and treat patients. So not only are we looking at a expansion of the known technology of CRISPR-Cas9 or CRISPR-Cas12, we're also looking at how it's integrating into healthcare. So the problem that they were facing was that people with beta thalassemia inherit defective copies of the gene that makes hemoglobin, and that's the molecule that red blood cells use to transport oxygen throughout the body. However, everyone's body has a second copy of that gene. So you have two different alleles, two different copies. And you have the second copy, they say here, is fetal hemoglobin. So after you're born, that copy of the gene gets shut off. In the clinical trials that they have linked here, scientists are employing CRISPR editing in an attempt to turn the fetal gene back on, because they're thinking that is why people with beta thalassemia are having such issues with hemoglobin, having to get all these transfusions. Outside the body, the treatment involves collecting bone marrow stem cells. So these are usually bone marrow progenitor cells that are totipotent, or even, well, at this point, they will be pluripotent from an adult patient. And then they fix their DNA in the lab using CRISPR. So they take the specific bone marrow cells and manipulate them in the lab with CRISPR by reintroducing the other copy of the gene. After that, they reinfuse these cells back into the bloodstream. So they re-inject the cells, probably through intratibial injections or by injecting it to the hip. In theory, the one-time treatment could cure the disease, though it's too soon to know the result. CRISPR Therapeutics says it will wait to see how its first patient responds before treating more people. The company also has plans to treat patients with sickle cell anemia using the same strategy. So I don't know how effective sickle cell anemia patients are, like how effective the results will be, how promising the results will be with sickle cell anemia. You are changing hemoglobin. This is why it's called sickle cell anemia, because the red blood cells look more sick. They look like a sickle more than the round shape you saw earlier. Um, this is uh, a germline mutation. It's not just a somatic mutation. So this means that you're getting this mutation from your parents. There's also different severities of sickle cell anemia. So if we go on and continue, this is just a short blurb of the study from MIT Technology Review. But they say CRISPR Therapeutics and Vertex claim they're the first companies to treat a patient with CRISPR. However, the technology has already been used in China on cancer patients, some participating in studies supported by biotech companies that are already there in China. So as we suspected, as I know, there are a lot of Chinese companies that are already using CRISPR to treat patients. There was a couple articles about that. I've heard discussions about it where people have presented unpublished data on how they're doing, how they're using CRISPR. So we go to sickle cell, already gonna come up. We go to images and we look at how sickle cell really does look different, how the cells look different. Normal red blood cell versus a sickle cell. And we also look here and see there are different types of sickle cells, and that is introduced with the severity of sickle cell disease. Of course, you're going to be anemic because the cells need it for oxygen. The cells need it for, you doing having basic functions in your body. They're not shaped properly. They don't move properly. They block the other cells that are normally shaped from getting through the blood vessels. So if we go also to the clinical trial that was done, they are looking at safety and efficacy. Let me try to move this over a little bit. Let's see, here we go. So they're looking at safety and efficacy study evaluating CTX001 in subjects with transfusion-dependent beta thalassemia. And CTX001 is the drug that they're going to use. It's the intervention and treatment. So they're using a drug on top of CRISPR-Cas9. So they have, in a brief study, this is an open label clinical trial. This is on clinicaltrials.gov. They have a single dose phase 1-2 study in up to 12 subjects, 18 to 35 years of age with transfusion dependent beta thalassemia, TDT, non-beta 0, beta 0. The study will evaluate the safety and efficacy of autologous CRISPR-Cas9 modified CD34 human hematopoietic stem and progenitor cells using CTX001. So this is how many participants they have, 45. Let's see. The start date was September 14th, 2018. Primary completion will be February 2021. Study completion will be May 2022. So they've given their measures, their primary measures, their secondary measures of what they expect to happen. And anybody can look anything up you want. One of the main things I look for are where they are going to collect their samples. So locations are going to be Toronto, Canada, Germany, United Kingdom. Then these are the companies sponsoring them, Vertex and CRISPR, of course, because doing this in patients is very expensive. Anyway, I wanted to bring that to you all's attention. I hope that this is an article that helps someone, especially those of us who have older family members and those of us who are interested in CRISPR, interested in science and how it works. This is literally a clinical trial that is out there right now. Any clinical trial you want to know about, you can look it up. Any particular tissue, any cancer, any disease, you can look it up. And I'm pretty sure there's a clinical trial out there on that subject. But I'll leave you all with the links in the description box. I hope to see you in my next video. Thank you for stopping by. I'll talk to you soon.